I'm a clinical psychologist from the neuropsychology department at Addenbrooke's Hospital, and I'm here to talk to you about cognition and behavior in CADASIL. So let's go to the next slide. So when I'm talking about cognition, it is a term that describes all of our various thinking skills, including things like memory, attention, speed of processing information or taking information in, um, things like executive functioning, or what we would call our higher level skills or higher order skills. It can include things like your planning, problem solving, decision making, and it can also include certain aspects of our what we would call our personality. Um, so when we think about cognition in CADASIL, people often ask whether it is affected in CADASIL. And for many people with CADASIL, yes, it is affected at some point. And it's often when people are in their 40s or 50s, but it can occur earlier or later. And it usually occurs after transient ischemic attacks or strokes or mini strokes. The cognitive difficulties that are seen are usually kind of dependent on the location of the stroke, or sometimes it can be dependent on the nature and location of the vascular problems that are there due to CADASIL. And it may be subtle at first, but it can become worse as the disease progresses. Some of the common cognitive difficulties that are seen in people with CADASIL are, as I have detailed in this slide. And I've kind of given a summary of each of those things. But we will go through some of these things in some detail, and we'll talk a little bit about what are the ways in which you can, some of the strategies by which you can try and manage some of these difficulties or cope with these difficulties. So let's start with apathy. So apathy is basically, this kind of loss of motivation or loss of or reduced motivation or loss of kind of get up and go. And it's often kind of described as, starting trouble sometimes. And problems with initiating self-directed or goal-directed behavior or purposeful behavior. And again, apathy is quite common in people with CADASIL. So 1 out of 3 people with CADASIL can experience apathy. And it usually kind of appears in association with or in conjunction with other cognitive problems, like, and we will talk about that in some detail, but it can also occur in conjunction with other functional problems and sometimes occur along with depression and other mood problems as well. And it can be confused with depression, but it is separate from depression. And apathy is often kind of related to structural changes in the brain. Whether it can be related to the site of the stroke or the location of the stroke, or it can be related to wider network disruptions as well. And people with CADASIL and their families are both affected, but sometimes the family can be affected worse. And I'll tell you a little bit more about that as well. There was a really nice qualitative study that was done in people with apathy and how they experienced apathy. And they've kind of identified some common themes. Such as kind of feeling like a burden, and losing one's sense of self. So how do we kind of define ourselves? How do we have a sense of identity? It's through things like, your personality, your qualities, your skills and things like that, but also things like, what you like, what you enjoy, what your hobbies are, what you dislike, all of those things. And sometimes when you feel less motivated to do these hobbies or do the things that you like, or take part in your interests, that can feel like you are losing a sense of yourself or losing a sense of your identity. Other things that kind of other themes that kind of emerged in this study was feeling like you are hindered by invisible obstacles. So this is a really nice quote that I'd like to kind of read out. So it says, "I had started a painting, but then the telephone rang and I wouldn't know what to do. I wouldn't know whether to stop painting and answer the telephone. If I answer the phone, I forget where I was on the painting and I just wouldn't carry on. So it's really interesting the way that he or she kind of explains it, because it explains that feeling of stuckness. You feel like you are stuck in that particular situation. You can't, that feeling of inertia where you can't do the next thing or start something new, or just feeling of inertia of staying doing nothing or staying doing the thing that you're already doing. So it's really the way that they explain it's quite interesting. And that's why sometimes it can be quite difficult for people around the person with CADASIL to understand that very well. And it can be quite, sometimes it's very difficult for people around to understand why they are apathetic, why they're not doing something that can be helpful, that they know themselves can be helpful for them, can be, they find pleasurable. It's not that they don't find pleasure in the activity most of the time. Once they start doing the activity, they do find it pleasurable, they do find it enjoyable. So people around the person with CADASIL is not quite able to understand why they just don't do what they like doing. So that can kind of lead to, frustration and kind of anger, and feel like they're just lazy, or it can feel very difficult to kind of manage that feeling of kind of almost sometimes resentment as well. And these are all feelings that are quite normal to feel, but also, and it's also very valid to feel these feelings. But also, it is important to note that this is not something that the person with CADASIL is doing deliberately or on purpose. And sometimes, spouses and families can struggle with guilt as well. So, you don't want to feel like you're the person that is nagging all the time, or just kind of going on, tricking somebody into doing something. And this feeling of changed roles, and you have to adjust to the way things are right now. So there's a new life, new role. So you're sometimes becoming, part carer, part planner and organizer. Some of the shared responsibilities that you previously used to have, you now have to take on a lot of the chunk of that yourself, and that can kind of lead to, exhaustion and fatigue as well, and sometimes even isolation. So you find that spouses and families find that they don't have time for their own hobbies and to get social support as well. Um, Now, before I go on to kind of talking about managing apathy, I'll just talk a little bit about depression as well. So, as I said, depression and apathy can coexist, but it can be present separately. And apathy can also be a symptom of depression. But apathy due to neurological disease is different from depression. And if you feel that the person with CADASIL does have depression, then definitely do seek treatment. You can speak to your consultant or GP if you're not sure. But some of the key differences are, people with depression, one of the main things that is affected is the mood, and they have feelings of low mood and sadness, whereas people with apathy, it's usually kind of volition or motivation that is primarily affected, and they have loss of goal-directed activities. And people with depression, as I said, they have loss of pleasure in activities, or they don't enjoy doing the activities as much as they did before. Whereas that's not usually the case with people with apathy. Once they start doing the activity, they still enjoy the activity, and they often report that they feel kind of passive about their situation and may have kind of a flat affect, but it doesn't mean that they're not enjoying it. And people with depression, the feelings of kind of low mood and um, uh, sadness can come along with negative thoughts as well, such as, like, feeling worthless or guilt, feelings of guilt or worry about life events, and sometimes they can also kind of experience suicidal thoughts, whereas that's again not the case with people with apathy. And they often feel kind of generally tired or bored or disinterested or disengaged in their life, and not purposely. Again, it's not, this is not something that they do deliberately, but and that's something that sometimes people who are around them, like spouses and families, find difficult to manage and deal with, and then they feel that they don't really care, or they don't really uh, they're not bothered, but that's not really the case, and it's because of changes in the brain that that happens. Um, so thinking about kind of managing apathy, as I said, because they still would do some of these activities if they're prompted, if they are given that kind of sense of routine. One of the things is to kind of develop a daily or a weekly routine and prompt as and when required. Prompting is slightly kind of different from nagging. So, it might be, you can say, yeah, so we decided that we're going to do this at this time. Come on, let's do it. And that could be kind of prompting, whereas nagging would be, I told you yesterday, we're going to do this. And that can be frustrating for the person that's saying it, as well as the person hearing it as well. So, and I know it's very, very difficult to get to that point where you don't feel like you are nagging, but it is something that kind of comes with a little bit of practice as well. Include a lot of enjoyable activities, activities that the person with CADASIL has previously enjoyed and continues to enjoy. And limit choices and decisions to be made. So sometimes, instead of asking, what would you like to do today? The person with CADASIL might often kind of respond, if they have apathy, they might often kind of respond, "Oh, I don't know, I'm not sure." Whereas saying something like, would you like to go for a walk, or would you like to go out for a meal now? And so kind of limiting the choices and decisions to be made might be helpful. And kind of having a short checklist of what needs to be done leading up to an activity. That can be helpful. Instead of having like a big task or big complex task, like submit the PIP application. Instead of having that as one task, break it down into much smaller chunks, much smaller manageable chunks, like, start with download the PIP form. Second step would be to print out the PIP form. Third step would be to only fill in all the basic information like your name, your address, and things like that, and then go on like that. So it might become a little bit more manageable that way, and it can seem less daunting overall. I'll also talk a little bit about kind of managing depression and mood disturbances. So depression is also quite common in people with CADASIL. And sometimes they can also have other mood disturbances like anxiety or emotional lability. So emotional lability is when you there can be kind of rapid mood changes, and you have disproportionate reactions or disproportionate emotional reactions to things that normally don't are not that emotive. So, for example, sometimes people have told me that there'll be something mildly sad on TV, and then they just kind of burst out crying sometimes. So. That is an example of kind of emotional ability. And sometimes, as soon as they are distracted, there's something else that crying is gone. So one of the ways to kind of manage that is to kind of understand that this is not personal, and it's again because of changes in the brain, and it's helpful to kind of explain to other family members as well. And so other grounding techniques can be used, like sensory distraction. So as I said, when somebody is distracted from that situation, the emotional response goes away as well. So using sensory distraction, so having like something, some soft item or a soft or a furry item or something that you can squeeze and feel in your pocket before you get to that point when you start feeling like you're getting overwhelmed. You can just kind of distract your mind to that item. So that can be quite helpful. And this is commonly used in people. This is a emotional ability is seen quite often in people with stroke as well. And so this is quite commonly used in people with stroke as well. Other things that can be helpful for improving mood is, psychotherapy and medications, which you can definitely talk to your GP about. But also other things that we mentioned previously, routine and activity, social interactions, exercise, all of those things are really, really helpful to improve mood. But one of the things that I would like to mention is that some of the strategies that we described are similar for apathy and mood, but these strategies look to improve mood, whereas these strategies don't necessarily improve apathy. It is more about managing apathy and making it easier to live with. The apathy, once it's there, it's likely that it is going to be there. Sometimes it can get worse as well. Other cognitive difficulties that are often kind of noted by people with CADASIL is kind of reduced thinking or slowed, so not reduced thinking, reduced speed of thinking or slowed thinking. So sometimes they can find it quite difficult to take in large amounts of information in one go. So some of the ways in which to kind of help with that is to slow down and use simpler language if it is helpful. It's not quite the same as being patronizing. It can be done in collaboration with the person with CADASIL. You can kind of ask them, will it be helpful if I kind of explain it in a slightly different way? Will it be helpful if I use other words or kind of rephrase it a little bit? And it can be also helpful to kind of present information in smaller chunks. It's very similar to what we talked about in terms of breaking things down. But when and that can be really quite helpful for processing information and make sure that the person with CADASIL does understand it and it has absorbed it before you move on to the next bit. You can also present information in more than one format. Present kind of key facts and highlights only if specific details are not necessary. So, and generally just kind of allow more time. Another cognitive difficulty that is often described by people with CADASIL is rigid thinking. It is basically when you just kind of feel fixated. Sometimes people have explained this in such a way that the person with CADASIL seems to be fixated on one thing at a time, and it's this kind of situation where you are not able to quite shift ideas or change ideas or adapt to different ideas or activities, even when the environment is encouraging you to, or even when the circumstance or situation requires you to change. So a good one of the most important things to kind of manage this for people around you, around the person with CADASIL, is to be patient. Sometimes kind of rational and logical arguments are helpful if it is given in a gentle manner. But if not, try not to get drawn into these long and drawn out arguments or discussions. It only kind of leads to frustration for both person with CADASIL as well as person around them, and consider kind of letting it go if it is not unsafe. So I've had some people tell me that my husband just watches Channel 4 most of the time. That's all he's fixated on Channel 4. And sometimes it's helpful to kind of letting it go, let that happen if it is not unsafe. Sometimes it's helpful to kind of have other routine things to kind of help with managing that situation, but sometimes it's okay to just let them watch Channel 4 sometimes. But if it is unsafe, then consider other ways to kind of keep the person with CADASIL safe. Other cognitive difficulties that are commonly seen are difficulties with problem solving. So Sometimes people can have difficulties with anticipating consequences and anticipating what could happen uh, uh, when you're trying to solve a problem. So sometimes they have difficulties in understanding the depth and the width of the problem, and generating different ideas as to how to solve the problem. Again, the person with CADASIL can do this themselves to a large extent, because a lot of the brain functioning, or brain networks that are supposed to be doing this is not working as well. You can try and consciously do that yourself. So just step back a little bit when there is a complex problem, kind of step back a little bit, and kind of start trying to think about breaking it down into, again, much smaller chunks. So first of all, kind of identifying specifically what the problem is, and thinking about what the solution to the problem could be, and then generating different ideas to approach that problem and get to that solution, and listing pros and cons of each of these ideas. And that can be really helpful for another cognitive skill like decision making. So can be helpful with making decisions about what is the idea to finally choose. And sometimes it's helpful to kind of get help from other people around you. So, share the task, have a joint ownership of the task as well. Some of the other cognitive difficulties include kind of disinhibition and impulsivity. So people can sometimes act without thinking through the consequences of behaving or acting or saying something in a particular way. And that can kind of, sometimes it can be it's most kind of often seen in social situations. Sometimes it can lead to it would be they have poor judgment, which can lead to sometimes them saying slightly inappropriate things or doing slightly inappropriate things. And people around them can help this by distracting them if it is caught early enough. If you know that certain situations are more likely to uh, um, uh, result in them being a little bit more impulsive, result in them being a little bit more disinhibited, then you can prepare for that or plan ahead for that. And person with CADASIL, they have been told that sometimes they can be slightly inappropriate. It's helpful to kind of take feedback from people that you are close to, people that you trust, like friends and family, and so one or two people that you are very close to. And other people around them can, again, distraction is helpful, redirection is also helpful. And I think one of the key things to remember is that the person with CADASIL is not, again, deliberately trying to be difficult or upsetting. It's because of, again, the changes in the brain structure, really. The other thing that we have noticed is, and people with CADASIL have reported, is problems with planning. So, um, step by step kind of checklist can be placed in key locations in the house for sequencing. So, for example, you can put a checklist up near the front door, so that the person with CADASIL can kind of they know what to check things off as they leave. So, for example, you've got your wallet, your keys, your phone, whatever it is, you can make sure that you've taken them all, check them off, and go out. But similarly for kind of routine tasks. So if you do the laundry, or if you do the dishwashing, so having like a step-by-step checklist of what needs to be done, how to operate the uh, dishwasher, or how to operate the washing machine next to it, can be really quite helpful. Now, people with CADASIL do have difficulties with memory, but not quite with long-term memory. But long-term memory, at least in the beginning, most people don't have that many problems with long-term memory. It's more kind of short-term memory that people struggle with. So that's basically because of difficulties with attention. So if you're not able to kind of pay attention to the things in the moment, or if you are struggling to kind of pay attention to things in the moment, then it is more likely that you are not registering that information, or you're not processing that information, and then that can lead to you won't be able to remember that later. So so for example, we often hear, you would say, um, tomorrow we have to go out for that meal, and then you probably would have heard it, but it's not quite processed. And then the next day you don't remember it because it's not gone through that whole process of encoding that information, registering that information, storing that information. Therefore, you won't be able to remember it later. So a um, good way to kind of help with that is to have planners and diaries and calendars and things like that, so that the person with CADASIL can kind of keep referring to and rehearse constantly and refresh their memory really. And have regular times during the day or the week to review your diary or review your planner. And one of the things, having like a good memory center or like a whiteboard, which I have kind of put up here, is a good idea in a prominent place in the house where, person with CADASIL can often see it. Other things like, so for example, prompts can be quite helpful. Quizzing can be less helpful. And that's something that, it's really interesting because, saying something like, here's your granddaughter Jenny is helpful, instead of kind of saying, can you remember her name? Because when you say, here is your granddaughter Jenny, it's more like, it's helpful with rehearsal and it's helpful for refreshing your memory. But when you say, can you remember her name, it's automatically already confrontational. If the person doesn't remember, then it can be quite frustrating. It can cause a lot of distress. And that kind of environment is not very helpful for or conducive to memory anyway. So it's helpful just to kind of give them opportunities to rehearse, that's all. Now, we talked a little bit about cognitive difficulties. We'll talk a little bit about some behaviors as well that can be quite challenging. And these are also related to cognitive difficulties, but but I'm talking a little bit more about kind of if somebody feels more aggressive or feels more irritable or feels angry, that can be quite difficult to manage. And when that does happen, make sure that you are prepared. So be prepared for that situation as much as you can be. We can talk a little bit about that, and then kind of reassure the person. Distract or redirect the person if you can, and de-escalate the situation. So when I say be prepared, if there is a reason for frustration or anger or aggression, if there is a very straightforward reason, like for example, is the person in pain? Are they struggling to communicate something? Are they frustrated because of that? If that is the case, then try and kind of address that, and try and figure out what the triggers are. And that can be done using kind of careful observation. So what happens just before the behavior, what or who seems to exacerbate it, what or who seems to help settle the behavior, and what are the common themes. And that can be helpful for kind of planning as well. And reassure the person. So if there is an unmet need, if you know what the unmet need is, then if you can give that to them, then give it to them. If you don't know what the unmet need is, or if you can't give them what they need at that particular point, then just try and kind of reassure them, tell them that you're there, you've heard them, you are there to support them. And most people respond well to that, but sometimes it might not be helpful, and in that case try and distract them. Sometimes they may feel like, again, you're stuck on something or fixated on something, so ask them to kind of come and help you make a cup of tea, or ask them to come and look at a problem in the garden that you need their help with, or give them something else to do, and keep that alternative behavior long enough so that they've forgotten about what they were angry about or irritable about. And the last thing is to kind of de-escalate that situation. So try and kind of, we all kind of communicate through verbal and non-verbal techniques, and try and kind of um, um, uh, be aware of your the nonverbal messages that you are communicating, because a lot of the communication that we do is through nonverbal techniques. So 70% of our communication is through nonverbal techniques. So, and it's not easy. I can always kind of say that, but it's not easy in the moment to feel relaxed or maintain a relaxed body posture or control your breathing. But this comes with more and more practice, really. So that can be it can be really helpful to kind of be aware of that when you do that, and it can help de-escalate things in the long term as well. So I'm really aware of time, and so this is the last slide anyway. So the managing general kind of principles of managing cognitive and behavioral difficulties. What I would say is um, get help from wherever you can, so don't say, so if family and friends ask you for help, say yes to any help. And if you need peer support, carers groups, social services, nursing support, and things like that. And make sure that your life includes a lot of kind of leisure, exercise, and fun as well. And be kind to yourself, and that's not just for people with CADASIL themselves, but also for their families and carers as well. Um, so yes, I think that's it from me. Thank you so much for listening.